Okay, now I'll let everybody in. There's only 3 people there, though, just so you know.
Well, if this is recorded, remember it's going to be on Zoom. So. Hi, everybody. We're just going to wait a couple of minutes so that anyone else who is in the process of being connected to the meeting can join us. So it's 2:01 right now, and we'll start in a couple of minutes. Welcome. You know, those couple of minutes can feel like a really, really long time. So I'll go ahead and start. So welcome to the HEAL Trauma RFP pre-bid meeting. My name is Maria Juarez-Stouffer. I'm the Chief Program Officer at CSC. So this afternoon, we'll be going over some areas of the HEAL Trauma RFP and answering your questions. I'm going to start with the timetable, which is on my page 30, on my page 3. It's on my page 3. Hopefully it printed out that way for you guys as well. And I just want to highlight some important dates for the timetable. So,
sorry, Maria, give me 1 second because it's not allowing me to share, and I want to make sure that I'm sharing the right documents so they can see what's happening.
okay.
So I'm going to try this and see if this works. Are you all seeing it now?
Yep.
Great, thank you.
Yep. Can it, is it, I don't know if it can be, Erin, can it be any bigger or no? I can see. There it is.
Definitely make it bigger. Yeah.
Okay. So just some dates that wanted to make you aware of regarding this procurement. Today at 4 o'clock is the time when you can begin to submit written questions through our CAP system. So we'll do our very best to answer your questions during the pre-bid, and at the end of the pre-bid, 4 o'clock onward, you can submit written questions through the CAP system until, hold on for a second, let me just orient myself to see where I am. Okay, so you can submit the written questions via the CAP system until November 19th at 4 o'clock. And then by November 30th, we will post the responses to the questions. And those responses, it'll be in a question and answer document, and it'll be posted in the CAP system. So we have noticed that in past procurements, potential applicants don't always go back and pull that question and answer document and review it. So we're really strongly advising you to go into the CAP system and pull that document and review it. It'll summarize all the questions and answers today. We will, if needed, add additional details to questions and answers today. So if there was an answer we gave you and we realized there is additional information that's going to help you, we'll add on that additional information to help you. So that's why we really strongly suggest, advise, encourage you to review the final question and answer document that will be posted in the CAP system by November 30th. Another important date is December 7th. This is the deadline for submission of agency financial viability, and you would submit that in the CAP system. So if you do not submit your agency financial viability information by December 7th at 4 o'clock, you cannot proceed with submitting the application. So that's a really important date for you to remember. So we will provide you with feedback by December 13th of your financial viability test results. And if we let you know that you need a fiscal sponsor, that fiscal sponsor will have until December 20th to submit their audited financial statements in the CAP system for our review. And then the deadline to submit the application is January 11th, 2022 by 4 o'clock. The applicant interviews will be on February 10th. So if you guys would, if you're planning on submitting an application, please mark that date down for applicant interviews. And then we will take the committee's recommendations for funding to our council on March 17th. And our council will review those recommendations and vote upon them on March 17th. And then we begin contract negotiations right after the council meeting. These contracts would be effective May 1st through September 30th of 2022. And they have 3 renewal options connected to them. So this timetable is important. I would suggest you make a copy of it, keep it someplace where you can refer to it and make sure that you're adhering to the deadlines in the timetable. So next section that I'm going to go to is on page 5, which is who may apply. And wanted to emphasize that the Children's Services Council invites applicants with experience in the provision of culture-centered, trauma-informed mental health support services for families. And our definition of families are youth and families. It's youth and families, and youth meaning you'll have a childbirth up through 17 years old. So wanted to be clear that this isn't only youth services. We're looking for family services. And then the youth and families to be served need to live in the designated racially segregated and high poverty communities that have been impacted by trauma. And to drill down to where those communities are, let's see, it's I think it's attachment 11 that speaks to the social. Attachment 11 of the procurement will give you the areas within Eastern Fort Lauderdale that we're really looking to focus the services. So, and who may apply? Nonprofit organizations, for-profit organizations that are qualified or incorporated, and government entities. And then we have allocated for this procurement $650,000, and that is a 12-month amount. So it's $650,000 that's been allocated for a 12-month amount. This contract from May 1st through September 30th is obviously not a 12-month amount. So the applicants will submit a 12-month budget, and then we'll prorate it to the May 1st through September 30th time period. So, and then for desired population, again, youth between birth and the age of 17 at the time of enrollment and their families. So again, it's a family service that have experienced trauma or are suffering from chronic trauma at the time of enrollment and live in Central East regions of Broward County. So we're looking for Fort Lauderdale and unincorporated Broward County. That's the regions that we want the services focused on. And when we talk about this attachment 11, it will drill down to the desired cities and neighborhoods that we want the services focused in. So attachment 11, they're neighborhoods with high levels of social vulnerability. The Centers for Disease Control created a social vulnerability index. And the social vulnerability index is an indicator of need within a community. So again, keep on talking about these are the areas we want you to focus services on. And we want it to be a family focused service. So that is desired populations. And I'm going to turn it over to Brooke Sherman to go over the program components that start on page 6. We will, once Brooke is done with her section, we will take a break and answer questions.
Hi, everybody. So as Maria said, I'm Brooke Sherman, and I'm going to talk about the program components that can be found starting on page 6. They go through page 8 in the RFP. And so we are currently looking to purchase community mental health model that utilizes trusted community members who help other community members access services and advocate for system change to better support their community. So it's really important that the awardees delivering this model have the ability to provide the program components, including a strengths-based needs assessment, resource map, family empowerment, which includes outreach, health advocacy, school system advocacy, financial resources, legal advocacy, linkage to career counseling and job training, and informal counseling. All of the program components can be found in detail under section G on pages 6 through 9. For the implementation plan, which is on page 9, these are just to be able to provide you guys with more guidance. It's a tentative implementation plan that assists guiding you with the procurement. So we generally ask you all to provide us with your implementation plan, but since this is a new area, we wanted to communicate our expectations with you. So please note that the anticipated contract implementation date is for May 1st, but it will depend on contract negotiation process. And then for the staffing requirements, which can be found on pages 9 through 11, it's extremely important that to best support these communities, that the Heal Trauma awardees are ensuring they're making diligent efforts in staff recruitment to identify passionate, qualified staff dedicated to long-term engagement within the community. So the goal is to hire staff trained in the community mental health worker model who have connections to identified communities and are trusted community members to hold the role of the community mental health worker and the community mental health worker team lead. So very specifically that we're looking for staff to be hired from the communities being proposed to be served, that they're living there and they're trusted within the community being proposed to serve. Currently, there's a cadre of 26 individuals that are in the process of their practicum, and we'll be encouraging the awarded agencies to meet with them as they will have completed the CMHW training. All of the community members will need to complete a 30-hour community mental health worker training along with a 500-hour practicum. They will then be eligible and encouraged to take the Florida Certified Health Worker exam. So more details about those standards can be found on page 9, including the website for certification from the state. The community members participating in this process will receive stipends for their training and practicum hours. And the CMHWs also will receive coaching for the certification process. We are anticipating having another cohort of training the beginning of the upcoming year, and they will be ongoing as needed throughout our fiscal year. We will be providing the support to all community mental health workers after they receive their training throughout their practicum and doing the work within the agencies as well. So on page 10, it outlines the description of your anticipated staffing pattern. It's inclusive of 1 supervisor, 1 team lead, and 3 to 4 CMHWs. The CMHWs will not be providing clinical support, but clients might need additional behavioral health support and connections. And that's why each program will have a master degree level supervisor. All staff hired must pass level 2 background screenings. And please note in the job descriptions, there are minimal salary requirements that can also be found on page 10. So again, it's really important to understand that these community mental health workers need to be trusted community members of the community you're proposing to serve. And they do not need to have a mental health background. That's why there will be a supervisor, clinical supervisor there to provide additional support. For the research section, you'll see attachment 3. There's really good information in attachment 3. We really encourage you to review it. And I will turn it back to Maria.
Are there any questions over the areas that we've covered so far? And so let me just share, we've been funding community mental health worker, the 30-hour community mental health worker training. We started funding, well, I'm sorry, let me clarify. Our Behavioral Health Coalition funded the first cohort of the training, and that first cohort for us happened in, I think it was April. And we, CSC, paid for the $10 stipend for the community residents who attended the 30-hour community mental health training. And then they were connected to community agencies where they began a 500-hour practicum. And CSC paid $10 an hour for those community residents to be part of that 500-hour practicum, in addition to paying a stipend to those master's level supervisors that were part of those community agencies to provide supervision and coaching to the community residents who were part of that practicum. So from that group, there are a number of folks from Central Broward County that if by the time this is awarded, they may still be interested in applying for a job with the awarded agency for Central Broward County. If they've moved on and gotten other jobs, we will do another training, and then we'll work with the awarded agency for Central Broward County to identify the residents from those areas who would be interested in going through the 30-hour training and then the 500-hour practicum. Because this is such a new initiative, if the central awarded agency decides that they want to, they have people they've identified that are going through the training and they want to go ahead and hire those trainees, they can do that. And then that trainee would become a full-time employee of the agency, and their $10 stipend would not apply anymore. They would become a salaried employee who is now finishing a practicum and providing direct services. Do you guys have any questions about what I just said? I mean, we keep on pushing, supporting, encouraging. You must hire residents from the communities to be served. We've had ongoing conversations with residents from these Eastern communities and presented this procurement idea to them. And their ask was very much that we recognize that there's a lot of strength within these communities, and there are residents who are qualified to provide support to other residents given the given additional training and supervision. So that is a model fidelity piece of ours, that the employees that are hired be from the communities to be served. And for the community mental health worker, the minimum qualification is a high school diploma, and that they pass a level 2 background screen. And of course, they have to go through the 30-hour training, and they have to either engage in the 500-hour practicum or through their full-time employment receive practicum experience. And this is the beginning salaries that we have. The minimum salary for the program supervisor, who will be a master's level clinician, is $60,000. The minimum salary for the team lead, for the community mental health worker team lead, is $37,000. and the minimum salary for the community mental health worker is $32,000. So if you wanted to pay them above the minimum salary, you can propose that. And I want to emphasize too that the community mental health workers will not be providing any kind of therapy. So what they will be providing is connections to other community residents, and they'll be able to connect them to additional resources. So the additional resources may be connecting them to a therapist through the Broward Behavioral Health Coalition, or connecting them to therapists through Children's Services Council. If they don't need therapy, it could be helping them through the Career Source Broward process of so there are a lot of different services that the residents will be connected to. So I just wanted to really emphasize that the community workers who will then become the community mental health workers, the community residents, they're not providing therapy. They would be providing support and then connection to ongoing services. The reason we wanted a master's level clinician to supervise this team is we recognize that there may be situations that the community mental health workers encounter someone who is going through a really difficult time, and that community mental health worker and that family may need additional support in that moment. So then you have the master's level clinical supervisor who will provide that additional support. So any questions so far? I don't see anyone raising their hands. I don't want to miss anybody. If you do have questions, please feel comfortable asking. So there are no more questions. So this briefly on page 15, 16, we talk about the cone of silence. And once a procurement is advertised, staff cannot answer individual questions. If you call one of us and you have a question about the procurement, we can engage in answering those questions. The pre-bid conference is the time to ask the questions, either during the time we're together right now or up until 4 o'clock on Friday, November 19th. And just recognize that, you can have conversations with rating committee members either. We take the rating committee member list to the council. Either we've taken it or we're about to take it. So that becomes public record. I just wanted to remind you guys that you should not be engaging in conversations about this application with any rating committee member that's on that list. Yes, Joanne, I see you have a question.
Yes, my question is about attachment 11. Is this the time to ask that question?
Yes, you can.
Okay. So when you go to the last page of the attachment, I see you can click on the area, like a red area, and it'll take you to the census tract. Yeah. I'm wondering if it will work the other way. For example, if I want to click, when you look at the first page, you see the zip code areas. And let's say I want to click on 33314 to determine what neighborhoods are in there. Is there any way that connects back with the next table, or is it just about clicking through all of this?
It would be about clicking through all of it.
Okay.
Yeah. Yeah, and we provided that. We wanted possible applicants to recognize that there are areas within Fort Lauderdale that have high social vulnerability, and those are the areas that we want the services focused in. If there is a family who lives in Fort Lauderdale who needs services and doesn't happen to live in one of these areas, we're not going to turn them away. They will get assistance, but we wanted the services focused in these census tracts. So the outreach, when applicants think of community events that they may want to do, like let's say you get awarded funding and you want to do a community event to let the community residents know about these services, we would want you to look at these census tracts and do those kinds of community events in those areas. So that's, again, we really wanted you to focus on these areas as the main areas for outreach and engagement and client services. Are there any other questions?
I do have a second question.
Sure.
So I understand that the expectation is that the services are provided for the people who live in the areas in the attachment, and that the community mental health workers would be from those communities. Would there, for the community mental health workers that you've already trained or that are in process, so they've already been vetted, so to speak, as having come from this area? And is that going to be a requirement? Let's say they live in an area that's close by a red or an orange, but not in an orange area. Would they then be excluded?
So our preference is for the community mental health workers to come from the areas from the communities really that are being proposed to be served. If someone lives in a neighboring community and they are a trusted community member, so that, some of these areas are right next to each other. So there could be they could live in the census tract right next to the census tracts on the list in attachment 11. So we will consider that person as being able to go through the community mental health worker training and become an employee. What we didn't want to see, and this is why we're really emphasizing strongly that we want community residents from the communities to be served, is we didn't want to see, I don't know, someone, I'll just come up with a city, someone who lives in Coral Springs, who now will be hired to be a community mental health worker to work in Eastern Fort Lauderdale. They don't know the residents, they don't know that area. And what the residents have said to us is, please don't do that. Please hire from within our communities. So we are honoring that through the request in this procurement to do that. If there is, a situation where you need someone who speaks Creole and you haven't been able to find anyone who lives in those communities, then we would consider allowing someone outside of those communities to be hired, but we would really need to be assured that every possible outreach to recruit from within the communities has been done.
Makes sense. Thank you.
You're welcome. Any other questions? So I talked about the pre-bid conference, which is what we're having right now. At the end of the pre-bid conference, you'll have beginning 4 o'clock today till 4 o'clock on November 19th to submit questions through the CAP system. And then on page 17, 18 is the application submission components. And just wanted you to review that section. There's a certification of accuracy and compliance page that must be signed and uploaded into CAPS. It is available in CAPS to be downloaded. So you literally download it. You make sure that the original signature of the designated agent that's officially authorized to act as the contractual agent for the organization is on that certification of accuracy and compliance. And then you load it back up into the CAP system. You also have to complete the IRS W-9 form. And again, it's available to be downloaded in CAPS. The organizational chart, you'll need to submit an organizational chart that shows where this program would fit within your organization. And then page 1 of your agency's 211 organizational profile that's on file with 211. So we are great supporters of 211 and want to make sure that their database is up to date. So whenever we do a procurement, we ask for the organizations that are submitting applications to make sure that they are registered with 211. And then we just ask that they give us the page 1 of the agency's 211 organizational profile to demonstrate that they're registered with 211. And then this is a unique service area. But what we ask is that if you have non-CSC monitoring reports and outcome performance data for similar services that you've completed within the last 12 months, you can upload those monitoring reports for review by the rating committee members. And then if you're proposing to use a site for services that you don't have control over, we just want to make sure that there's a memorandum of agreement for that site. So if it's your own site, then you don't have to worry about it. These services are community embedded services. So we expect the community mental health workers to be in the communities providing services for the most part. And then the line item budget is you also need to submit that. And again, all applications must be submitted to CSE through the CAP system by January 11th, 4 o'clock. And then after 4 o'clock, the system will not allow anything to be submitted. So I know we're all so busy. I really encourage you not to wait until 3:50 on January 11th to begin your submission process. We do have a help desk, but the help desk is not like a 911 emergency desk. So don't wait until the last minute, please, to submit this. I know there's going to be a lot of work that you do, and I'm sure it will be tremendously disappointing if you're not able to make the deadline for submission. Let's see what else. So on page 18, we talk about under terms of agreement, these contracts we're expecting to begin May 1st of 2022, and they would go through September 30th of 2022. Of course, that is dependent upon successful negotiation of the budget and the contract. So May 1st would be the earliest time. If for whatever reason we're not able to finalize our negotiations ahead of time, then the contract might start later. But we're hoping for May 1st of 2022. And there are 3 renewal options for these programs. So we have included on attachment 5 our core contract. Please review our core contract before you consider submitting an application to us. The core contract is not negotiable. So just make sure that the sections within there are something that your attorney looks at and that you feel like you can abide by. And then conflicts of interest, and that's, we talk about this on page 21. So the application for funding has a relevant question on conflicts of interest, and conflicts of interest need to be disclosed. And if you think you have a conflict of interest, please disclose it in the application for funding under that relevant question. And then we go into what a conflict of interest could be on page 21. And application rating tools are, we include in attachment 2 the application rating tool. And we strongly encourage you to review the application rating tool. And if it's possible for you to finish your application ahead of time, you could always have someone look at your application, look at the rating tool, and make sure that you're answering the questions with the highest amount of points allocated. So make sure that you're looking at the rating tools as you're creating those applications. And are there any questions for the sections that I've covered or before? No. Rashida, do you have a question?
I do. Good afternoon, everyone. I just wanted to know, it seems as though the application is pretty much the same as before, just minor things have changed regarding the deadline dates and the time frame. I just want to confirm that nothing new has been added. I didn't notice anything major or new that was added to the new RFP.
So I would say that, you know, we always review our applications before we reissue them. So there may be some tweaks to the application. So I would advise you to review it. And if you have and you haven't seen anything significant, then you've answered your question.
Okay, thank you.
You're welcome. Are there any other questions? No. So I'm going to turn it over to not for the measuring impact and continuous learning section. And I think that's either Laura or Travis. I'm not
That's
sure.
me. It's
Okay,
Laura. Hi, everyone. My name is Laura Gansey. I'm the Director of Research and Planning with the CSC. I'll be going over the measuring impact and results-based accountability sections of the procurement. As most know, we currently collect and report on performance measure data across all of our funded programming in order to hold ourselves accountable to using taxpayer dollars and understanding how our services make a positive difference in our communities. We also know that providers have a wealth of expertise that could be used to improve programs, systems, and ultimately the lives of those that we serve. And this has led us in the past several years to work alongside providers and gathering data beyond that of our typical accountability outcomes in order to inform our service delivery and system improvements. We do continue to use results-based accountability in our evaluation process, which ultimately asks the questions of how much did we do, how well did we do it, and is anybody better off? For the HEAL program specifically, we want to collaborate with providers, participants, and the community to develop the process for answering those questions. So in order to do that, we'll be using an emancipatory evaluation approach to measure the impact, value, and significance of the HEAL services. This methodology will engage provider staff and service recipients in assessing how these services are making a measurable impact and what would be the best means through which to measure that impact. So in this process, everybody will be co-designing those measures of success or the outcome tools that are going to be used to evaluate the program. The approach is highly collaborative and focuses on highlighting the voices of those that would traditionally have their voices silenced or minimized. It contrasts to traditional evaluation methods in which there is an assigned expert who extracts data to analyze and measure difference. So with this approach, the research team is going to be co-designing and co-leading the process, ultimately determining the process for continued evaluation. It's important to consider how your organization will allocate time, support, and energy to this process because staff and program participants will be highly engaged throughout. Additionally, there will be a concurrent emancipatory research project that program staff will be expected to participate in. That project will focus on questions regarding mental health and resiliency in Broward County. Staff will be co-researchers in both initiatives and will be expected to attend trainings and actively participate in data collection, data analysis, and solution building based on the findings. Additionally, HEAL staff are expected to participate in learning communities, which will be designated opportunities to share experiences with the emancipatory process, performance measurement, and program implementation that will hopefully help all members involved learn what's working and what needs to be adapted, removed, or corrected. Once initial evaluation methods are established through the emancipatory evaluation process, processes for gathering data, data entry, and reporting will be determined and regularly reviewed. A CSC is in the process of hiring an action researcher that will be specifically assigned to these programs and will provide ongoing support and participate as part of the research team. This is definitely a very different approach that we're taking towards performance measurement for these programs specifically, and we are very excited to embark on this journey with all of the awarded providers. Are there any questions? I don't see any. So I'll turn it back over to the PS team since I don't see any questions. Of course, I'll be here till the end of the pre-bid. So if any questions come up later, I can answer them.
Thank you, Laura. So next on the agenda is Alicia Williams, Assistant Director in our Finance Department. We'll be going over some fiscal and budget items.
Hi, good afternoon. Thanks, Maria. My name is Alicia Williams, and as Maria said, I'm the Assistant Director of Finance. I will start by reviewing a very important area of your RFP submission, and that is the agency viability submissions that you will do, which is on pages 16 through 17. So your agency must submit your most recent audited or reviewed financial statements that cover the latest fiscal year end in our CAP system before you can submit your RFP application. This must be done before Tuesday, December 7th by 4 p.m. That's the absolute deadline. The most recent audit is defined as an audit that covers your agency's latest fiscal year end and must be completed and available within 180 days from the date of the agency's fiscal year end. After the initial review of your audited or your reviewed financial statement, CSC will allow for a financial viability review period, and this will allow for clarification or to provide additional financial information as requested. This period will also allow the agency to obtain a fiscal sponsor if needed. You can expect to receive the results of your financial viability test no later than December 13th. You will receive an email with the results, and you can also see the results once you log into your application in the CAP system. If an agency fails to submit the agency financial viability section in CAPS by the deadline, you will not be able to apply for this procurement. Please note, if you are currently funded by the CSC and have already submitted your agency's most recent audited or reviewed financial statements to the CSC, you just need to indicate this by checking the appropriate box in the CAP system in the agency financial viability section. Also, if you are currently funded by the CSC and you utilize a fiscal sponsor, or if the CSC does not currently fund you, but you already know you're going to need a fiscal sponsor, you don't have to submit your agency's financial statements. However, you must indicate the agency is using or will be obtaining a fiscal sponsor by checking the appropriate box in CAPS in the agency financial viability section. Now let's talk through your budget form, which is your program budget form that you'll use for this. The program budget is going to be a crucial part of this process. And what we've done for you, we've provided some resources to assist you in creating your budget. In the CAP system, under solicitation attachments, you will find a sample video and a template for your reference. Additionally, in the same area, please watch the video on how to create your budget and the guidelines that accompany this video. This is all in the CAP system. Some areas of your budget, which are on page 19, is going to be your startup expenses. And these are budgeted items that are needed in advance to prepare and start the program. Please keep in mind, these funds must be used within 30 to 90 days of the contract effective date, and these are cost reimbursement funds. Hence, support and documentation will be required for reimbursement requests to support these expenses. Another part of your budget is your units of service, which is on page 20. And these are expenses that are not reimbursed on a cost reimbursement basis, but these are rolled into a unit cost. These are your operational costs. Once you are awarded, your contract will identify the maximum number of units which can be billed to the CSC. You'll also have a match requirement, as CSC seeks to fund projects that can operate in a fiscally sound manner. As such, there is a funding requirement of at least a 5% match for all funding provided through the CSC. Your match can be provided as cash, or it can be an in-kind contribution, such as volunteers, administrative overhead, equipment, or space that you have dedicated to this project. Another part of your budget is your administrative costs, which is on page 21 of your RFP package, and applicants can request up to 12% of the total direct service costs in administrative costs to manage this project. Your administrative costs, they support the operation of your entire agency as a whole, and these are related to your day-to-day operations, and they pertain to your operational expenses rather than those expenses that are directly related to the provision of your services. Some examples of these are your payroll costs, maybe your management staff salaries, and your audit fees. On pages 26 to 28, it discusses your financial viability and your performance requirements. All agencies that are requesting funding from the CSC must demonstrate financial solvency utilizing the financial viability test. The statements that you are required to submit to us will allow us to perform the financial viability test. Once we do the test and the total points are calculated, The final score will determine the maximum level of funding that may be awarded to an agency over the CSC fiscal year. Keep in mind, once you are funded, agencies must demonstrate an ongoing capacity to meet the CSC financial performance standards. If an agency financial viability status changes at any point in time during the RFP funding cycle, appropriate revisions to your funding or your contract terms may be necessary at the time of renewal. Now, based on these test results that we're going to receive, your agency if you wish to apply for funding beyond the restrictions that result from your financial viability test, you may secure a fiscal sponsor that can pass the annual fiscal test without restrictions. This fiscal sponsor role is to receive and administer the funding provided by the CSC. They're going to act as a capacity building resource for the agency, carrying out the program activities, and they're also going to serve as an accountable provider of record in this tri-party agreement. The CSC will provide an unrestricted fiscal sponsorship fee directly to a fiscal sponsor to help offset the administrative costs incurred by the sponsoring agency. The fee will be up to 7% of the total funds awarded to the sponsoring agency, not to exceed $25,000 annually. Remember, the deadline for the submission of your agency financial viability section in CAMPS is December 7th by 4 p.m. Any questions? Okay. Okay. Since there's nothing, I'll turn back over to you, Maria.
Thank you, Alicia. So next is CSC Agency Capacity Building Attachment 4.
Hi, Maria. Come on.
Hi, Dama.
So good afternoon, everyone. So today I'll be discussing the 3 capacity building supports related to this HEAL procurement and the services that are available specifically to awardees of this grant, and then some that are also available to all child and family serving nonprofits within the community. So just a global view of what we provide. Since our inception, CSC has really given support to our funded provider network, as well as local child and family serving nonprofits in a variety of different ways. We have a very comprehensive training program that includes hundreds of different training topics, and just a little bit shy of under 100 trainers specifically. We focus on skill building trainings, and that will provide some of the fundamental skills and some specialized trainings under that skill building umbrella that will all serve to kind of improve service delivery. In addition to that, we have professional development opportunities geared mainly towards supervisors, managers, high potential staff members. Most are instructor-led. Now that we are unfortunately in the times of COVID, a lot are being done online. We have very few still being done in person. Outside of the professional development, we also have leadership development trainings that is for middle level management, C-suite and high potential. So as you're looking to kind of build a capacity for your organization through these grants, know that those training opportunities are available to you. And then in addition to those 3 areas, we also provide some training in specifically for the development of organizations. So things specific to fundraising, HR development, developing strategic relationships. So outside of that, we also have our agency capacity building committee, which either funded providers or local child and family serving nonprofits can benefit from. Membership in that committee allows you access to receive monthly newsletters, attending the agency capacity building meetings, which we hold on a quarterly basis, specialized training for nonprofits, and then some specialty series trainings that we have that don't fall under that other umbrella that I mentioned. And outside of this grant opportunity, we also manage our annual capacity building infrastructure grant, which comes out typically over the summer and will afford between 9 months to 12 months of financial support as well as coaching and consulting for specific areas related to business function. We also provide one-on-one consulting and coaching to nonprofits who are in need of just basic advisement. Typically that will lead on to referral to one of our business partners, either the Small Business Development Center of South Florida or to the SCORE Broward, the Senior Corps of Retired Executives that both serve as anchor partners for CSC, but we do the one-on-ones to kind of give people a groundwork. In addition to that, we also manage the racial equity training and the related initiatives that are tied to that. So specifically for this HEAL initiative, I know that Dr. Gansey went over the emancipatory research training, so we'll be supporting the coordination of those efforts, as well as the opportunity for funded agencies through HEAL to get support from a program performance consultant. Specific benefits to the awardees related to that will include skill building support in areas such as financial management, documentation, verbal communication, budgeting skills, monitoring preparation, and whatever other areas come up based on the needs assessment. So that program performance consultant will be working with the leaders and also staff within your agencies, identifying some specific growth areas based on the assessment and working with you to kind of skill build and make sure that whatever deficiencies are found will be properly addressed and that you get to a good place in terms of organizational effectiveness and sustainability. The next area that you'll also receive support in will be business coaching and consulting through the Small Business Development Center, and that will be an as-needed service. For the past 6 years, we've been working with the SBDC, and they have been doing business-specific related assessments on the nonprofits that we have partnered with. CSC provides funding similar to what you'll receive through HEAL. And then the SBDC will work with you to make sure that the programs and projects that you are funded to provide happen very seamlessly, and a lot of the back of the house and business functioning is, performed well. So outside of that, we also will be supporting you guys in terms of some of the learning communities and helping to organize those efforts. So you'll be getting a lot of capacity building support through this grant, and we look forward to working with you.
Are there any questions for Adama?
Maria, were there any parts underneath that, the section with the SBDC?
I don't think so.
Okay.
Thank you, Adama. Next, I will turn it over to Trisha Jowell.
Good afternoon, everybody. I am going to talk briefly about our contract administration and procurement system, otherwise known as CAPS. This is our web-based system that we are now using for procurement application and the rating of the applications. We do have a very detailed video available to you that will walk you through the entire process of how to use the CAPS system and how to apply for a procurement using that system. The video is about 20 minutes long. It's available, as you can see here, on our CSC webpage under the Procurements and Funding Opportunities page. It's also available right within CAPS itself. So if you are looking at the HEAL application, right under the solicitation attachments where you see the RFP, the application, the rating tool, all those documents at the bottom, you will also see a link to this video so you can watch it at any time. Just wanted to point out that if you are having any technical issues on using CAPS, you are able to send an email to the help desk at helpdesk@cscbroward.org in order to resolve any of those technical issues. Just keep in mind that we are not available 24/7. If you are having any type of issues, please submit the help desk ticket immediately, and we will get back to you as soon as we can. But I think, as Maria mentioned, please Don't wait until the last minute to start using this system, because if you do have an issue at that time, we might not be able to get back to you immediately to address it. I think it was already mentioned at the beginning, but the CAP system is also where you will go if you have any questions after we end this pre-bid today. So if you want to submit any written questions, then you would do that in the Ask a Question tab that you will see in the top ribbon of the application. And that'll be open starting today at 4 through Friday at 4 p.m. And like I mentioned, the CAPS application video is listed under the solicitation attachments in HEAL. That's the same place that you would also find the budget video that Alicia referenced as well. Are there any questions on CAPS? I'm not seeing any, so I will hand it back to Maria.
Thank you, Tricia. Are there any questions overall about the procurement? That would be, yes, Joanne.
Hi. On page 10, the positions are clearly explained. And then when I went to the budget area, they showed 4 community mental health workers. So I'm wondering if that's just an example, or is the composition to be 1 supervisor, 1 team lead, and 4 community health workers?
So let me just look at what you're referring to. Page 10.
Page 10 outlines the positions, which you talked about. But then when you go to the budget, it's specified in the sample budget, there are 4 community health workers. So my question is that what you're looking for? A team of 4 community mental health workers, or is that up to whoever, is that up to the proposer?
So it would be okay to submit a proposal with 4 community mental health workers. If you wanted to submit with 3 community mental health workers, the team lead and the supervisor, that's okay too.
So is more acceptable?
More than 4 community mental health workers?
Correct.
I would not suggest that. And the reason why is you will be recruiting residents from the communities. So we want to make sure that we have 4 strong residents from the community plus the community mental health worker lead, which would be the 5th resident. And once the programs are up and going and we have some track record, we could expand teams, and we expect to do that. But to start with, we're recommending the 4. If you feel like 4 is too much and you want to propose for 3, that's okay. The community mental health worker lead, and then the clinical supervisor.
Thank you.
You're welcome. And I'm glad, so we did include a budget to help you develop your budget. And that is as a guide for you when you're developing your budget. And hopefully that will help you through the budget development process. Are there any other questions? I'm going to reiterate, please watch the CAPS video that Tricia talked about. Please watch the budget development video that Alicia talked about. They both are helpful. It will be helpful to you in the development of your application and inclusive of the budget. So strongly encourage you to watch that. You will have until November 19th at 4 o'clock to send us any additional questions through the Ask a Question tab in CAPS. So if you can watch those videos before then, and if you have any questions after watching the videos, go ahead and submit those questions. Yes, Leslie.
Sorry, this is Rashida again.
Hi,
I
Rashida.
apologize. But my question is, will this video be available to watch at a later date?
Yes, so the pre-bid conference video will be available. What I will say is that the question and answer document from this session, and then any questions asked afterwards until November 19th at 4, that document does take precedence over this Zoom video. So what we do with that, with the question and answer document, is we obviously bring in all the questions that have been asked. We look at our answers, and if there's additional information that would be helpful, we then add that to the answers. So absolutely, this recorded Zoom pre-bid conference will become available, but please remember to look at the pre-bid question and answer document. That will take precedence over this pre-bid Zoom video.
Thank you.
You're welcome. Are there any other questions? No? I want to make sure I don't end with any other questions pending. Okay, so then just a reminder, you have until Friday, November 19th at 4 o'clock to submit any other additional questions in writing. As Tricia pointed out, we do have a help desk if you're having any technical issues with the CAP system. So if it's not a technical issue and you send us a question through the help desk that's more related to how, an RFP type of question, we won't be able to answer those questions. So make sure to ask questions that are RFP related in the CAP system up until this Friday at 4 o'clock. All right, and for any technical issues, go ahead and go to the help desk to do that. Thank you all for joining us this afternoon. I hope that this has been helpful to you. Look forward to reading your proposals. I wish you all the very best.